Hi, I'm Natalie Bouchard, and you're listening to Inside NC Labor, a podcast designed to inform and educate North Carolina citizens on the role that the Department of Labor plays in state government. Hi everyone, welcome to Inside NC Labor. I'm Natalie Bouchard, and I have my fellow Public Information Officer Dolores Questenberry with me.
Hi everybody, thank you so much for tuning in today.
And we are lucky enough to have two special guests with us. We have Labor Commissioner Josh Dobson. How are you, Commissioner?
I'm doing well, thanks, Natalie.
Good. And we also have Dr. Mandy Cohen, who is Secretary of the North Carolina Department of Health and Human Services. How are you, Dr. Cohen?
Great to be with you. Thanks for having me on.
Yeah, of course. Today we're here to talk about the COVID-19 vaccine and the rollout. We're here to talk about who's eligible and how they can schedule to get their shot. NCDOL and DHHS have been working together to promote this and to educate the public. We have a lot to get into this episode. So first I want to ask Dr. Cohen, could you update our listeners on who is currently eligible and how they can register?
Sure. Well, first, again, great to be on, and thank you, Commissioner Dobson, for inviting me, and great to work with you in your new seat that you're in. I'm really looking forward to working with you. And, I know we're going to spend the time on, a lot of vaccine work, but I just have to step back and say it is incredible that we are a year in, and the fact that we have 3 safe and effective vaccines is really an amazing accomplishment of science as well as manufacturing. It's been a hard year on all of us, but we know that vaccines have been the tool that we've been waiting for to really put an end to this crisis, and I'm excited about it. Some folks may think that by the fact that we were able to get these vaccines quickly, maybe there were some corners cut, but what I want folks to make sure they understand is that scientists had been working on their ability to create a vaccine like this for many years. So the COVID-19 vaccines that we currently have are built on years of work to develop vaccines for similar viruses. And so we're really lucky that and the federal government accelerated the manufacturing, the production of these vaccines, really has put us in a place where we now have nearly 30% of the population of North Carolina has had at least one dose of a vaccine. That's terrific. That's really, really good progress. And so we're grateful. And in terms of folks who are eligible, so who are those folks in that 30% that have already gotten vaccinated? We started with our healthcare workers because they were exposed to COVID directly, taking care of COVID patients. And then we wanted to focus on those who are at the highest risk of a bad outcome from getting COVID. So we're at the highest risk of being hospitalized, highest risk of death. And when we look at the data from North Carolina, we saw that the folks who are at the highest risk really broke down by age. Those over the age of 65 represented about 83% of the total deaths we were seeing in North Carolina. So when we were thinking about, we know we're not going to have enough vaccine to get to everyone at first, we definitely thought about getting to those who are at the highest risk of exposure, right? So like healthcare workers, and who is at the highest risk of bad disease or death. And for us, that really fell along the age lines. Now, that's not perfect, right? There are some folks who are under 65 who have higher risk, and some, people who are over 65 who are incredibly healthy. But it was our best proxy, if you will, to be able to do that. So we started with healthcare workers. Then we also had long-term care residents and staff. So those are folks in nursing homes. They're both medically vulnerable as well as living in a setting where virus can spread easily. Then we were for much of January and February vaccinating those who were 65 and older. Then more recently, in the end of February, March timeframe, we've moved forward to vaccinating our frontline essential workers. These are folks who can't stay home to do their job, but are in particular sectors that really keep our world working, whether that's our first responders, our police, firefighters, there are teachers, our child care workers, and our manufacturing, our agriculture sector. So those are our frontline essential workers, and particularly those who cannot stay home. So it means that they are at higher likelihood of having an exposure. And then we also moved on to now vaccinating anyone with a medical condition that puts them at higher risk for serious illness from COVID-19. Now, I do want to flag for folks, the eligibility is changing all the time. I am hopeful by the beginning to mid-April that vaccine is going to be open to anyone who is over the age of 18.
It's moving very fast.
Mm-hmm.
So on this past Friday, Commissioner Dobson, I was able to witness you getting your shot in Lenoir, North Carolina. Can you talk a little bit about that, about your experience, and what would your message be to anyone who's on the fence about getting the shot?
Yeah, it was a great experience. I went down to Caldwell UNC Healthcare with President Laura Easton. They had a phenomenal setup there. We walked in; they were very welcoming, and it wasn't just to us from Labor, but everyone and anyone that was there that day was treated with the utmost care and respect. So they had a well-oiled machine, if you will, and it went really well. I felt a little slightly weak later on that day and a little bit into Saturday, but by Saturday evening, I felt great, and by Sunday, I felt really good. So it was overall a great experience,
Mm-hmm.
and would just encourage everyone that's eligible, when they're eligible, to get the vaccine as quickly as possible.
Great.
All right, so Group 3, which Dr. Cohen already kind of touched on, includes frontline essential workers. They're eligible for the vaccine now. Commissioner Dobson, what kind of industries and workers are included in this category specifically?
So a few to mention: food and agriculture, those in meat packing, food processing, our farm workers, our H-2A workers, I believe, and restaurant staff all fall into that category. Government services, court workers, postal workers, elected officials, healthcare and public health that weren't covered in what Dr. Cohen talked about earlier in the first group that was vaccinated, public safety, police, fire, correctional officers, our EMS workers, transportation, public transit workers, DMV workers, maintenance and repair workers, all fall into that category. So certainly want to get everyone that qualifies as frontline essential workers vaccinated as soon as possible.
Dr. Cohen, why is it so important for these workers to get the vaccine now? And how can we encourage employers and employees to sign up for the vaccine?
First, I want to mention that in addition to those frontline essential workers, because we're also vaccinating those with an underlying medical condition, that also includes a large portion of North Carolinian adults. So I just want to touch on that for a second, if I could,
Sure.
because those who are employers may be listening and wondering if their employees might be qualified. And actually a lot may, because there's a lot of medical conditions that unfortunately put you at higher risk for COVID. We've known that, and we've been hearing that all year long. But just to share a couple of additional details, right? That's everything from cancer and diabetes and lung disease, heart disease, to smoking and being overweight. So we know from our data that group of people represents about half of the adults in North Carolina. So we know that a lot of them are over 65, because as you get older, you do get more medical conditions, but we know a lot are under 65. And so I really would encourage folks, whether you are these frontline essential workers that Commissioner Dobson was mentioning, or they have an underlying medical condition, we really want employers to really engage with their employees on the importance of getting vaccinated. These vaccines are not just helpful at protecting you, which they are. They're great at protecting you from the worst of what COVID can bring. It keeps you out of the hospital, and frankly, it saves your life from dying from COVID. And we know that is more likely to happen if you're older, but really could happen even if you're younger, particularly if you have an underlying medical condition. Mm-hmm. So we really want folks to protect themselves, but it also protects each other. The more people who get vaccinated, it means this virus can't travel. It can't travel to each of us. And that means the more of us that stop this virus from infecting us, we're actually also protecting our communities. It's another way, or an extension, if you will, of the 3 W's and how we slowed the spread of the virus all along. The vaccine helps us do that as well.
So speaking of those 3 W's that we've heard you talk about since the beginning of the pandemic. Once we get to a point where the majority of North Carolinians have been vaccinated, will we eventually move away from wearing masks, washing hands, and waiting 6 feet apart? I hope we still wash our hands, but
I hope everyone will wash their hands. But yes, the CDC has already shared new guidance on ways those who are fully vaccinated can return safely to certain activities. And I want to note, fully vaccinated means 14 days or 2 weeks after your second dose of vaccine, if you had Pfizer or Moderna, or 2 weeks after the one-shot Johnson & Johnson. That's what it means to be fully vaccinated. And if you are fully vaccinated, the great thing is that you can be together with other fully vaccinated people without wearing masks. And then you can also gather with an unvaccinated household, assuming it's just one unvaccinated household at a time. I do think it is important to note that we are going to still be wearing masks in public settings, particularly as we still ramp up getting everyone access to a vaccine. We know that there are many more people who want a vaccine than can get it at the moment, so we still have a lot of work to do to get more people vaccinated, but we're well on our way. So there is light at the end of this tunnel. I am particularly looking forward to hugging my parents for the first time in 15 months. I haven't seen them in person in quite some time. And now that I am fully vaccinated and they are fully vaccinated, they're going to be visiting for the first time in a long, long time. So I'm looking forward to that.
That's
awesome.
Fantastic to hear.
I'm feeling very optimistic.
Yes, me
about
too.
this.
And Dr. Cohen, you maybe touched on this percentage, but what percentage of the North Carolinians are fully vaccinated?
About 18% of North Carolinians are fully vaccinated. Again, that means they've gotten 2 doses of their vaccine, or they've gotten the one-shot Johnson & Johnson vaccine. And I should say I got the one-shot Johnson & Johnson vaccine, and I'm past my 2 weeks. So I am fully vaccinated along with 18% of North Carolinians. But what's really great is that 30%, so a full almost third of North Carolinians have gotten at least 1 dose of vaccine. And now we know there's still more that they need, but the fact that we are well on our way there is really, really good news.
I think, Commissioner Dobson, I think you got the Johnson & Johnson one-shot vaccine as well.
I did.
Great.
I did.
Yeah, and you talked about some of the side effects of the vaccine. Dr. Cohen, could you elaborate more on the side effects from the vaccines and how common they are?
Yeah, I think Commissioner Dobson's experience is pretty typical. You get, and I'll say what I got as well, which is my arm was pretty sore at the site for about 24 to 46 hours. I felt achy and a little fevery that night that I got the vaccine. But yeah, by the time the next day went by, I got a good night's sleep. I was really feeling back to normal. And now that I'm 2 weeks out, my arm is not sore, and I'm feeling very grateful to have gotten that vaccine, and it's one and done, which is so great.
Yeah, so for the North Carolinians getting 2 shots, are the side effects more common after the first or second dose?
Yeah, the side effects are more common after the second dose, right? But people should know that when their body, is feeling achy or feeling a little fevery, that's your body training, right? It's your immune system gearing up so that if it actually sees the real COVID virus, it knows how to fight it off. So actually, I think it's a good sign when people are having some of these milder side effects, because we know your underlying immune system is getting stronger, so it can fight off COVID. Now, remember, there's no COVID in these vaccines itself. They're not injecting a weakened form or a changed form of the virus. It is basically teaching your body how to identify the COVID virus if it sees it and how to fight it off. So it's not injecting COVID into you. And if you're getting those side effects, it means your body's learning how to fight it off.
Is there a major difference between the 2-shot and the 1-shot vaccines?
I think the biggest is really about, with Johnson & Johnson, it's really only 1 shot. We also know that the Pfizer vaccine, so there's a Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna are both the 2-shot vaccines. The Pfizer vaccine can also be used for people who are 16 and up, where the other 2 vaccines, the Moderna and the J&J, are really only authorized for people 18 and older. There are also, some differences on how the vaccines are stored, but they all essentially work the same way. They teach your body how to make antibodies against the COVID-19 virus. Pfizer and Moderna use something called mRNA to teach your body to do it. The one-dose J&J uses DNA, which more people have familiar in it. They use some DNA to teach your body how to recognize and fight off COVID. But either way, your body breaks down the RNA or the DNA, those blueprints that teach your body. So it's not like you're getting COVID into your body with these vaccines. It teaches your body how to recognize the real virus and then move from there. And so we're seeing that all three are safe and effective, particularly effective at keeping you out of the hospital and keeping you from dying from COVID.
So bottom line, and this is really directed to both of you to answer, what is the most important message you want the public to know about getting the vaccination?
So I would just say that I think everyone is hungry for normal. The things we used to take for granted that we no longer have been able to do. Secretary Cohen talked about spending time with her parents for the first time in a year. I talked Friday about one of my favorite things to do is to watch my daughter play high school sports. Things, again, that we used to take for granted. I think all of us are hungry for a normal. And the best way to get back to that is for everyone to get vaccinated as quickly as possible so we can return to whatever normal looks like.
I couldn't say that better myself. Vaccines are going to help us get control of our lives and back to the people and places we love. And the best way we can end this pandemic is to get people vaccinated as quickly as possible. We are fortunate to have 3 tested, safe, and effective vaccines that protect against COVID and keep people out of the hospital and keep people from dying. So we have the tools. We want to get back to that life that we love, and this is the way through using vaccines as quickly as possible.
One final question. Where can our listeners, or just the public in general, go to learn more about the vaccine?
For the most general information, you can go to yourshot.nc.gov, and that has a ton of resources. Both tells you about the vaccines themselves. You can put your zip code in and you can find vaccine providers in your area. Some of them link directly to scheduling tools. You can also find out what vaccine eligibility group you are in. Like I said, there are many, many folks who are currently eligible. And what we are finding is folks don't really know that they're eligible right now. So I'd really encourage you to go to our tool on yourshot.nc.gov, and it walks you through the eligibility. And I'd also point out that, like I said, by the beginning of April, we're going to be able to get vaccine to any adult who wants that. So we're very close to being to that point. So I definitely hope that folks are learning about those vaccines at yourshot.nc.gov and finding vaccine providers in your area. Walgreens, CVS, your health departments, your hospitals all have vaccine. And it's getting easier and easier to find appointments, get appointments. So we really encourage everyone to go get the vaccine as soon as it's available.
I couldn't agree more. And I'll just say that we also have links on the North Carolina Department of Labor website as well. And also say that the Department of Labor is proud to partner with Health and Human Services on this. Secretary Cohen and I talked a while back about hopefully, even though I wasn't in the legislature, that we would have an opportunity to work together again in the future. I'm not sure that we ever anticipated that it would be in this capacity. Nevertheless, the Department of Labor is proud to partner with the Department of Health and Human Services to get the word out.
Absolutely.
Fantastic.
Thank you for that partnership. It has been great, and it's wonderful to partner with you as we both think about the response to this pandemic, and we know the recovery that we're going to need to focus on as well. I know this has been an incredibly challenging year on so many fronts. Health, our personal and professional lives have been turned upside down for everyone. With vaccines, we're hoping to get back to that normal, but we know there's a lot of recovery focus that we need to work on.
Well, great. I just want to thank y'all again so much for joining us. I think this is a really important episode, and I just appreciate both of your participation. Thanks so much for tuning in, y'all. Remember, your safety is our priority.